Now, that is time for Medical Minutes with the Thompson twins, and instead of Doctor, we need to write a new song called Dr. Pharmacist. Maybe the Thompson twins can do that for us. We welcome back Dr. Thomas Rogers from the Cleveland Clinic Union Hospital in Dover. And Dr. Rogers, would you please do the honors of introducing our pharmacist?
I will, thanks Kelly. So we are really excited today. We have a really important topic, and pharmacy is such a huge thing that we have to deal with every day. Medications are not something you mess with, and people just need to understand it so much better. And so we brought our expert, our director of our pharmacy, Cathy Wiggs, who's been with the union for 15 years and is from Strasburg and went to Strasburg High School, and then went to Ohio Northern, and then got a master's at Walsh up in North Canton. So she has just been great for union. She really understands how to work with our docs and our patients, and her team is such an amazing group of people. And that's one of the things we wanted to highlight today is what she does in the hospital, how her team supports everybody here in the community. So we're just excited to be able to talk about the things that she does. And so I think she's got some great information today.
Fantastic. Well, Cathy Wiggs, welcome back, I should say, since you're a Strasburg native, and we are glad you're here practicing. And, you know, pharmacists, you are so important. I pick the brain of every pharmacist I see, and you're such an important part of the healthcare team. Why don't you tell us what all goes into the making of a pharmacist?
Sure. First, thanks for having me, and thanks, Dr. Rogers,
You're
for that
welcome.
introduction. So, pharmacists now, they graduate with a doctorate degree of pharmacy. So they have an undergraduate degree, typically in some type of science background, and then go and obtain their doctorate of pharmacy degree, which they do classes and then clinical rotations. Many of them then now go on to residency, a pharmacy residency, either 1 or 2 years, where they continue to hone their clinical skills. And now we're even seeing some of them that really want to get into research, or some of those real niche areas even go on to a fellowship. So pharmacy has changed a lot, not only in what we do, but also how we're trained. And we're really lucky at Union, like Dr. Rogers says, we have a great team of pharmacists. We have pharmacists in our outpatient pharmacy, which many people have probably seen. It's in our main lobby. We have pharmacists in a medication management clinic that sees patients and manages their medication on an outpatient basis. And then we also have a large number of pharmacists, typically not seen by the public because we're in the basement, in our inpatient pharmacy that are overseeing the drug regimens of all of our patients while they're in-house, whether it's right drug, right dose, helping the docs on rounds, providing education. We have a pharmacist that's in our emergency department helping those nurses and doctors care for patients, just really starting to embed ourselves everywhere where care is taking place.
You know, Cathy, I'm glad you mentioned the lower level of the hospital with an additional pharmacy. Many of us pop in. I love to go to the corner shop, get my coffee, maybe buy a card or a gift, and you see the main lobby area with a pharmacy there. But downstairs, you know, when you're in the hospital, you need a pharmacist maybe 24/7, as well as your medical care team. So I never thought about when you're actually in the hospital. The pharmacy closes, I'm sure, at a certain time to the public, but it's always going in the lower level.
Correct. So there's a whole separate team in the lower level providing pharmacy services 24/7. We never close. We're always there. A pharmacist there helping clinically take care of those patients. And you may not see us, but we definitely always see you either through a chart or through orders or something, always trying to focus on how to safely make sure that you are receiving the correct medications.
So for the overnight working pharmacist, my question, wink wink, is what do you do to keep your energy up and stay awake? That's for off the air, unless you want to share.
Yeah, well, I'm not one of those pharmacists, but I think some of it is just a natural, that's your time clock, how it works, but can't give you those hints because that's just definitely not me.
That's
so.
a different world, and we are so appreciative that pharmacy answers are there anytime. Cleveland Clinic Union Hospital Medical Minutes with Dr. Rogers and Cathy Wiggs. Cathy, let's talk about in the pharmacy world. Antibiotics are such a crucial part of our lives when they didn't exist hundreds of years ago, and now the antibiotic story is that it can be very effective, but you have to be careful. It's not like, Cathy, I think I have a sore throat. Could you give me an antibiotic? It doesn't quite work that way, right?
No, it doesn't. You know, antibiotics have to be prescribed in the right way because we have the risk of them, our bugs in the future becoming resistant to them. So you really need to make sure that you're only taking your antibiotics as your provider, your doctor prescribes them. You only take them for the length of time that they tell you to take them, and then if you have any left over, don't keep them in the medicine cabinet for when you or someone you know is feeling sick again to pull them out and give to them. Make sure that you discard them properly so that they're not hanging around for maybe another time you may be sick.
Well, and I've heard the good point was not only could they be dangerous into the wrong hands, but they just may lose effectiveness. So you think you're getting treatment and they're just not effective after there's a date on there for a reason.
Yes.
Cathy Wiggs, maintaining an accurate and up-to-date list of medications. I think all of us need to take this homework home today and update our list of medications right now. Why is that so important?
It's really important because often, especially when you come into the hospital for an emergency, you either may not be in the right frame of mind to provide the accurate list, and perhaps your loved ones just aren't familiar with it. And so often, like, we have trouble with, you know, that transition of care from the outside world to the inpatient world to make sure that we're reviewing to make sure we continue on the right medications, making sure any medication that we're going to give you doesn't have any ill effects because of, you know, your home medications you're taking. So it's really great to have an updated list, and some ways you can do that. Anyone that has a MyChart electronic chart through the Cleveland Clinic, your medication list is on there, so it's great if you have access.
Oh, wonderful.
Yes, to make sure that you can go on there, and probably the person that's going to make your decisions for you if you cannot in a healthcare situation, make sure they can access your MyChart also. We really encourage people, the last thing is, you know, a paper list, understand that, but those are really hard to keep up to date. So just make sure if you're doing that, you keep it up to date, and try not to bring all your bottles into the hospital because we don't like to keep them stored, and sometimes it's hard to get them sent home. So we'd much prefer an accurate list than a bag of bottles for sure.
Okay, that's really good to know. And how do I get started on the MyChart situation if I've never done that before?
MyChart, yes, you can definitely reach out to your provider who can send you an email link, and then that will be able to get you set up and get a profile started.
Okay, and also we are going to talk about in a moment a drug take-back day for all of those old medications and bottles. Cathy Wiggs joining us along with Dr. Thomas Rogers, another edition of Medical Minutes. We're talking with the pharmacist now, and let's talk about controlled substances, Cathy. Some classifications: depressants, antidepressants, hallucinogens, inhalants, narcotics, steroids, and stimulants. Would you talk about the importance of proper use for the patient and the entire community?
Correct. So just like antibiotics, it's very important that all of those medications, really any medication that you take, you're only taking it as prescribed by your provider. You don't share those with other people, even if you feel like they may have the same signs or symptoms that you have. And especially those narcotics and other medications that are controlled substances. When you're not using them and no longer need them, to make sure that you dispose of them, either at a drug take-back day or at any of the drug drop-off locations we have throughout our county. One is inside our outpatient pharmacy at the hospital. So just getting them out of your medicine cabinet, making sure you're not using them when you're not supposed to, making sure someone else doesn't get to them that shouldn't be taking them is really important, not only for your own safety, but the safety of our kids and other people in our community.
Cathy Wiggs, pharmacist at Cleveland Clinic Union Hospital on today's Medical Minutes. And you mentioned the Drug Take-Back Day. Let's talk about that. Coming up here next month, right? Dr. Rogers or Cathy, would you like to talk about that?
I think so. You have. I don't
Yeah.
remember the date, but you go ahead and
It's
talk
April
about
26th is the date, and
Okay.
it's sponsored by Empower Tusk. And they've done this several times. They'll set up a station in the south entrance of the hospital parking lot, and you can drive right up with your drugs and drop them off. And typically there's someone from the sheriff's department there to help collect them, take them, and make sure that they're disposed of correctly.
Oh, fantastic. A really easy, convenient way to make sure those are safely put aside. Cathy Wiggs, let's talk about when a patient is being treated and time for discharge. You know, before it would be another maybe exhausting stop at another pharmacy to take your prescribed medication. What happens now at Cleveland Clinic Union Hospital when a patient is discharged?
Sure, so all of our patients have the option to use our outpatient pharmacy that's located in our lobby. The doctor can send that prescription electronically right down to that pharmacy. They will fill it using your insurance, and you can either pick it up on your way up, or they'll even also deliver it right to your bedside before you leave. And we really think that this is important, not only because, yes, I hate just as much as everyone else to wait in line at the pharmacy, so it takes that step out, but it also makes sure that you're going home with the medication, because we don't want you to come back to the hospital. And a lot of people come back to the hospital because they don't take their medication, and that, it doesn't help the problem, they end right back. So taking it home with you, making sure you've got the right directions from our pharmacist, you know how to take the medicine, is really important. So not only is it a great feature as far as saving you time, but it's also a great safety measure too.
Boy, that's, again, if you've not dealt with being in the hospital for a while, that's really a nice feature to put you at ease, a little more peace of mind with the Meds to Beds program for more than 10 years now, I understand. So
Yes.
That's wonderful. Well, Cathy Wiggs, we really appreciate your time today away from the pharmacy. We hope our listeners look for you when they head to Cleveland Clinic Union Hospital, not in the basement, right?
No, don't come down to the basement, no.
Unless, Dr. Rogers, you're headed over to the cafeteria, right?
That's
There's
right.
some good things over
Cafeteria is
there.
great stuff in the cafeteria.
Uh,
Healthy
what-
food too.
Oh, great, great. Well, Cathy Wiggs from Strasburg to Ohio Northern to Walsh University here at Cleveland Clinic Union Hospital. Thank you so much for all your great information. And, really, your brain, I'm sure, is picked by many people. You might have just maybe a little more time than that doctor's appointment to really explain how important proper medication usage and disbursement is. So thank you. Keep up the great work. Dr. Rogers, anything else beyond today's?
No, I just really want to again thank Cathy for all that she does. They really keep us safe too as providers. Although that help that they provide us, say, hey, are you sure about this medication? There are so many medicines, so many interactions, and what they provide for us to make sure that all of our patients are safe is really something that we cannot go without. So we do appreciate all they do every day to help our patients and to help our providers as well.
Okay, Cathy, again, Dr. Rogers, thank you. We think back years ago when you had to do the manual, figure it out yourself for interaction, and this medication is not going to work if you're already on this. So important to communicate with your doc and your pharmacist as well. Cathy Wiggs, thank you so much. Dr. Rogers, Medical Minutes on today's WJER segment featuring all you need to know about the pharmacy. Thank you. Have a great day.
Thank you.
Thank you.